So welcome everyone, and thanks for being here. I'm Robin. I'm the moderator for the panel. So that means I'll talk as little as needed, but I may ask some questions. In general, we will have the teams quickly presenting a short intro of the research. So just 1-2 minutes. I think you had the time maybe to watch the videos beforehand. And then after each topic, we will allow some questions from the audience, from the other panel members, and from me. And then after a few minutes, we will move on to the next topic. I think we have 6 topics overall, so roughly something like 8 to 10 minutes per topic. And yes, if you have questions from the audience or from the panel, I think you can just unmute yourself. I think that's fine. If it gets too messy, we'll use the hand raising option, but otherwise you can just unmute yourself. All right, if there are no other questions, I think we can start with the first group. And maybe you can just quickly introduce your research. That would be You See Me Not, Masked Effects on an Environmental Tangled in COVID-19.
So there's been a lot of misunderstanding around COVID-19 and its effects on our environment, considering it as a positive effect. However, my partner's research was to find out whether it is actually true. But we have found that this belief that COVID-19 is a blessing for the environment is hugely illusionary. And we have found different, that's why we've called it masked effects, because they seem positive, but they're not. So for instance, I've talked about this in my video. For instance, transport pollution. Since the lockdowns and everything started, people believed that the environment is getting time to recuperate and finally breathe. But that's not the case. Actually, transport pollution is much higher than it was before. So is the emission of chlorofluorocarbons. So this is not, COVID-19 is probably the worst thing that has happened to the environment in a very, very long time. And it's high time that we put environment back into a priority list. So this is what our project talks about.
Okay, thank you. With this, I just open the round for questions. If there are any questions from the audience or from the other discussants, or comments as well.
And just raise your hand if you want to get going.
So I think there's a question in the chat from Garrett Fool, who asks, how can this be mitigated?
Can you hear me?
Yeah.
Yes, we can hear you.
Excuse me. Okay, so I will go issue-wise. So firstly, transport pollution. One major reason why this is evil in disguise is because people, I don't think, are no longer interested in using public transport or an Uber, sharing a cab, because everybody has their independent vehicles now. And my research showed that there's been a rise in the number of people who have bought secondhand cars, automobile parts, etc., just so that they can have the safety of traveling alone and reaching their workplace or wherever they want to go without contracting the virus. Another issue would be carbon printing. So carbon printing is the amount of greenhouse gases that a person or a sector's activity produces. So since we all know, we all know that our current entertainment is Netflix, Amazon Prime, and the like. And most people have no idea how much detrimental it is to the environment for them to be sitting at home and watching all of this, especially porn. The greenhouse, not only does the device that you're watching it in require power, but the data, the platforms also pull in a lot of energy for streaming it. So one thing that you can do to mitigate it would be to be mindful of the environment and watch lesser, which can be difficult. So we can switch to using mobile phones rather than your big screen TV, because mobile phones consume much lesser energy compared to the bigger the screen gets, the more energy it consumes. So that is one thing that you can do. Regarding transport, I think there is enough going around in the environment that enables us to plan things. So if you want to go out to the grocery store or pick somebody up, a little planning ahead would help a lot. That's another thing. One more thing would be how much family planning, the concept of family planning has deteriorated in the COVID scenario. There's a lot of research suggesting that we are on the verge of a baby boom. So overpopulation has always been bothersome to us. And COVID-19 meant that a lot of people lost their reproductive choices. Either people believed that they were no longer available because of COVID, abortion services and contraceptive services, or even if people went, there was a serious issue going on, which is COVID, because of which they never got the attention or the services that they wanted. That's number two. Another thing is fear. Fear of contracting the virus, contracting COVID-19, propelled a lot of people to not even approach a hospital or some other center for getting an abortion done. Stockpiling has been an issue. There's been no stock in different pharmaceutical centers of different contraceptions, because of all of which we have reached a point, even developed countries have reached a point where there's a lot of miscommunication. So what we can do is put this in the forefront, because overpopulation is a hugely bothersome concern. Communication, in the first session that we had in the conference, a presenter from Japan, he commented on how Twitter is popular for putting good communication. So Twitter and Instagram could be used in better ways so that there's better reproductive choice opportunities for the population right now. So these are a couple of things that you can do to mitigate the present evil that COVID-19 is putting up on the environment.
Thanks a lot. Maybe just a quick follow-up question. I think we then have to already move on to the next topic. I think in your research, you talk about the different aspects, and that people often also think there are positive environmental aspects, for example, because of slowed economic growth. Is there a way to measure these different kinds of positive and adverse effects so that you can say overall, in overall net, it's negative for the environment, the pandemic?
So I didn't get your question. So are you referring to the data that is available from the government side, or just data available on the internet?
On a general research question, so I think you have the conclusion now that actually COVID is a very bad influence for the environment, but there are also people that say it's positive because there's slowed industrial movements or in general economic growth that would have a positive effect. So have you tried to weigh these different kinds of positive and negative effects?
Yes. So that is exactly what prompted my research. What I have found is all these positive effects that people seem to put forward are actually negative. That's what I meant by masked effects, because when we weigh the effects of an issue, whatever it may be, you consider it long term, right? So when you look at it, maybe during a lockdown, there are lesser vehicles on the street, the factories are shut down, there are lesser people walking around, etc., etc. But when you look at it in the longer run, it's all the seemingly positive effects are extremely negative. That's what I've been trying to say through my research. All of them, actually. All of them, yes.
Okay. Well, thanks a lot. It's quite interesting. I think an important topic for all of us. So with that, I think we have to move on to the next topic in the interest of time. So we would go on, I think, to Marta Kalbi and the topic of the consequences of COVID-19 on social interactions, an online study on face covering.
Yes, thank you. Good morning, everybody. The study that I present today, and it has been published on Scientific Reports, aimed mainly to investigate during the first pandemic peak how the perception of emotional facial expressions is influenced by the covering of lower face features by different kind of protective face covering, such as sanitary masks and the scarf, and to investigate whether they also influence the physical distance as well as the perceived social distance from others. And to this aim, by means of a study that was available online between May and June 2020, Italian participants were shown static facial expressions in two different conditions of covering by sanitary mask and by scarf. And they were asked to evaluate the emotion expressed by the face, by the stimulus, in terms of valence and explicit categorization, and also to evaluate the physical distance and the social distance one would adopt with the person depicted in each stimulus.
Okay, thanks a lot for the quick introduction. And yes, I can ask if there are any questions from the audience or from the other panelists.
Hi. I was wondering how perceived social distance was measured and how it differs from physical distance. Thank you.
I'm sorry, I didn't hear you very well. Can you repeat, please?
Can you hear me?
Yes.
Okay. I was wondering how perceived social distance was measured, and so how it was different from physical distance. Since like in the media, the two concepts were sometimes the equally
Okay.
About what's your opinion about it?
For your question, so regarding physical distance, it regards the distance that people maintain between themselves and others, and is also known as interpersonal space. And the literature, from the literature, we know that after a traumatic event or in individuals that lived a traumatic experience, this distance is kept larger. While social distance from another perspective is reduced, and this means that after a traumatic collective event such as a pandemic, and in particular after the 2-3 weeks, during the 2-3 weeks after the traumatic event, people feels more tight as a community. In other words, it's like they fight together against the pandemic in this case, and this lead to the perception that they are more tight as a community. So we had the hypothesis that participants would differ in their evaluation in terms of physical and social distance, augmenting the distance in terms of from a physical point of view, and reducing it in terms of social bonding. Nonetheless, we didn't find this difference. The two variables showed same results basically, and we thought that the reason was that the study was available online between May and June 2020, while the lockdown, the first peak, started in March. So we were a bit late. Yeah.
Thank you.
Thank you. Well, I think I also have a follow-up question on the results of your research. So I think you found actually also some gender differences in the results. And I found it interesting on the one hand, do you have like a theory or like an idea why these exists? And second, I think the female participants were more reacting to emotions and not to the face coverings. And is there maybe also some, I mean, well, but I'm trying to say, does the emotion maybe reveal some information about the health condition of the senders? Maybe actually it's smart to like follow a smiling person because it's actually a better signal of being healthy.
Yeah, thank you for the question. Yeah, we did find gender differences. So basically, female participants tend to polarize their evaluation in terms of the emotional evaluation of the stimuli. So they gave more negative ratings to angry and neutral facial expressions than male participants, and more positive ratings to happy facial expressions than male participants. But I think the most interesting effect is on physical distance evaluation, because we found that while a female mainly chose the distance to kept from the other on the basis of the emotional expressions, so more distance for negative expressions, less distance for positive ones, male participants mainly cared about the kind of protective equipment. So they kept more distance from scarf, stimuli covered with scarf, and we interpret these results due to the fact that the scarf is far less protective than mask. In that period, there was a lot of confusion about the effectiveness of the different protective devices. But yeah, our interpretation was that one. And the second part of your question was about emotion.
Yeah, well, I mean, whether maybe when female participants reacted more to the emotions, whether it is actually maybe smarter because the emotions reveal more information about the health condition than wearing a mask. Or
yeah, it could be. We interpret the result in a similar way because literature, we know from a lot of studies on emotional processing tested and measured not in behavioral but also physiological, neurophysiological ways that female participants are more tuned to emotional, female in general more tuned to the emotional expressions of others. This could be also related to more empathic abilities that are more developed. Although I have to say that there is also, confusion in the literature in the sense that there are also other ways of interpreting this kind of effect. Yeah.
Okay, thanks a lot for the presentation. Is there some other question in the audience? Because I think we we'll move on also to the next topic. Yeah, six teams in 1 hour is a tight schedule. Thanks a lot, Marta. And yes, the next topic is on metaphors for vaccination and defeasible reasoning. And I think it's Francesca Ervas, right?
Yes, thanks a lot for the introduction. It's a joint project with Pietro Salis, who is here at the conference, and Rachele Fanari. We are all from the University of Cagliari. In the project, we consider metaphor as a reasoning and a communicative device in health communication to let people understand an abstract concept that is vaccination in terms of a concrete one, the beehive. That's why we use the beehive metaphor, because we think that the use of metaphors might be crucial to let people understand vaccination as an important collective health phenomenon. So we conducted a study to investigate whether and when a novel metaphor, the beehive metaphor, extends via a relevant property for vaccination, the property of cooperativeness, can be an effective reasoning and communicative device. We proposed to participants 3 scenarios described in either literal or metaphorical terms, comparing safe scenarios or a free rider scenario and the undercutting the filter, and the non-vaccinated community scenario. And we hypothesized that metaphor could improve the communicative effects of pro-vaccination text, especially in uncertain reasoning scenarios, so in the feasible reasoning scenario. And the results show that metaphor use is not a predictor of higher vaccination intention as found in previous studies, but the results confirm that hypothesis that metaphor is an effective communicative device and show that its effect is nuanced by the rebutting type of the feasible reasoning, so the scenario with the non-vaccinated community, for convincingness and emotional impact, and also the undercutting type of the feasible reasoning, the scenario with the free rider, and in that case for participants' trust in expertise and commitment to experts' advice.
Thanks a lot, Francesca. Are there any questions from the audience?
Yes, I would have a question. This sounds horrible. Did you control actually for understanding of the metaphors? Because there are people that would take them literally.
Yes, we control also the understandability. The understandability increase when we have the metaphorical condition, but this is for all the scenarios: the safe one, the free riders one, the no-vax community, the no-vaccinated community. In every scenario, there is an increasing in terms of understanding where we have metaphors. So we think that when we explain indeed a difficult to understand phenomenon as group immunity, I mean, from a scientific point of view, it's not easy to understand the immunity group effect. But when we explain in a text, in a scientific text, via another domain, another concrete domain, in this case, the domain of the beehive, it's easier for people to understand, to get the point of immunity, the group immunity effect. Thanks a lot for your question.
Thank you.
I think there's another raised hand by Oksana Babiluk.
Yeah. Morning, everybody. I would like to ask a question. Could you please provide some examples of metaphors?
Well, we explicitly vaccinate. We use as a metaphor for vaccination the beehive. In the past, some other metaphors have been used. For instance, they describe, to tell the truth, they describe flu. Scherer, for instance, and colleagues, they describe flu literally versus other conventional metaphor, as for instance, a riot, an army, a seed. And then they ask whether the people were prone to get vaccinated in the case of different description of the flu. While in our case, we describe the vaccination as a beehive where all the members are bees that are cooperative in the vaccination. So this is the example we use in the text we provided to participants.
Mm-hmm.
There was a reason because in previous work, there was another metaphor used, the herd immunity, which is highly conventional, but there was kind of reactance for people. They say that they didn't want to be sheep, mindless sheep in the herd. Mm-hmm. So it was counterproductive as a metaphor in the scientific test. And that's why we try to provide people with another novel, creative metaphor, the beehive one.
Uh-huh. Okay, thank you. Thank you so much.
Thanks for your question.
Actually, it's an interesting thought you just shared. It makes me wonder, do you think that such metaphors could also be used for, I don't know, like what we call nudging or general technological solutions to increase vaccination behavior?
Well, I think that it can be used. That can, of course, as I said, that there are some limits. Of course, there are some limits in nudging, and there's also some limits in the framing effects. And it can be used, of course. For instance, we tried also as a part of another project to use, for instance, the fire metaphor to improve social distance. So in that case, people are like matches or trees, and the COVID-19 is the fire spreading, and the matches need to keep social distance in order to not to spread or to stop the transmission of the contagion. And yes, it might be tested. And I think it might be useful also in the case of vaccination, especially in different cases of different scenarios where you know that there are no vax community or free rider, but it has been tested. It could be a good idea.
Yeah.
Thanks a lot.
Maybe one follow-up question.
I don't know whether Pietro want to add something or.
Well, point very interesting already made about the use of this kind of experiments is the one of potentially providing nudges in the future. If we are able, in a sense, to establish that there is a relevant pattern of influence given by the use of such metaphors in improving vaccination rates or something like that, this could be the beginning of a new project, as a matter of fact, where these results can be used in policy planning about vaccination as nudges, as a matter of fact. So your last point was really a good one, something we were trying to imagine when we first began to project experiments like this. So that's a good point, and thanks. Yeah.
Yes, I would have a follow-up question actually related to this. So two thoughts related. So one is, have you thought about coupling metaphors with some kind of storytelling? Because often metaphors are part of storytelling, and then often if maybe it's embedded in a story, it's even a stronger effect. And second part of it is, I could imagine that metaphors, it's not only that it's easier for me maybe to convince somebody, but also it might spread easier. So if rather than just providing information, people maybe not be willing or able to share this information with their peers, but a metaphor they can easily share. So there might be these indirect effects maybe in the population. Have you thought about these two things?
Yes, on the first question, indeed, the difference, we run other experiments, but in short context or really reasoning context where you have just premises and conclusion. And here the difference is that we embedded the metaphor in a story. So there is this storytelling component, and the difference is that the reasoning part is a little bit lost. So we don't really have the argumentative form with the conclusion, but the communicative effects are increased. So this is the effect of having a storytelling. And then for the other question, I think that it's very important, and I think that one of the points we are also testing on is the format. And I think that the visual format of the metaphor can be more effective in this sense, to spread the metaphor. As for another metaphor that has been used for vaccination is the umbrella that protect people, that protect also people from rain that are not vaccinated. And it is very widespread now, but at the very beginning when I started studying this question or this research question, it was not so widespread. Now with visual one and the social media, it has been widespread in reach more people surely.
Okay, thank you.
Thanks
a lot. Yeah, thanks a lot for the presentation. It's also very interesting, and I think also something we can all relate to. With that, I think we will move on to the next topic on disparagement humor permits unsafe COVID-19 behaviors. And I think I've seen already presenters, but now I can't see the video. Are you here?
Yep, I'm here.
Oh, okay. Oh, yeah, okay, there you go.
Yeah, perfect. Thank you for that. So my name is Andrew. I'm a humor researcher in the United States, and the project I submitted talks about disparagement humor. Disparagement humor is typically used to describe sexist or racist humor, humor that makes fun of other people. In this context, though, We're using it to talk about humor that makes fun of COVID, makes it seem not as much of a big deal, makes it seem something casual. Some good examples are jokes that make fun of the high survival rate. So you point out that 99% survival rate and people think, oh, it's not a big deal, that type of humor. You see a lot of memes like these on Facebook and Reddit, places like that. So there's a lot of work that shows disparagement humor acts as a signal to people that it's okay to tolerate this unsafe behavior, for example. So for instance, sexist humor has been shown to increase tolerance of discrimination against women. Gay humor has been shown to increase tolerance of gay discrimination. So just working out of that theory, we hypothesized that humor making fun of COVID, making it seem light, is going to increase people's tolerance of other people's behaviors. So to test this, we we assigned people to 2 experimental conditions, one where they saw no humor and one where they saw this humor that makes fun of COVID. And then they were given a situation to tolerate. So in this case, they saw this couple in a church not wearing a mask while they were singing. So they talked with the usher, and basically they had to decide how big of a deal this was. And people that saw the COVID disparaging humor were more likely to say that these people not wearing their mask was acceptable, particularly if they themselves did not think COVID was a big threat. That's a big moderator here. We used Reddit to collect data. That's the other big part of this. And we collected from a few different subreddits. They can kind of be seen as skeptic subreddits and non-skeptic subreddits. Places, so skeptic communities where they don't take COVID seriously, such as our No New Normal and our Coronavirus Circle Jerk. They made about half our sample, and then there were some other coronavirus wary and just non-coronavirus related subreddits as well. And what we found was that the skeptic communities were not affected by these memes that we showed them, probably in part because these memes were already there to begin with. These memes were just flooding those subreddits. So kind of like dropping a bottle of water in the ocean, you're not going to notice the difference. So I think that covers the gist of what I need to say.
Yep. Thanks a lot, Andrew. Yes, pass it on to the audience. Are there any questions for the research?
I will have a question for Andrew.
Certainly.
I was wondering whether there was some linguistic intimacy effect, you know, that, for instance, Cohen talked about linguistic intimacy, both for humor and metaphor, saying that, well, humor is quite demanding. So it's kind of a concealed invitation, and when another get the invitation, they form kind of new community among them. So I was wondering whether the results you had can be explained in this way, that they have, you know, they didn't follow the normative rules because they create kind of new community because of the intimacy feel by humor. They feel humor sharing.
I'm sorry, can you repeat that, the last 2 seconds there? I lost track.
Yes, that I was wondering whether they didn't follow the rules, you know, the normative rules, because they indeed, exactly because they were intimate in sharing humor, they built another community, their own rule inside the new community created by humor.
Yes. So the general theory that we're using from this is prejudice norm theory, which basically says you create a local norm of tolerance. So for example, in this context, if I share this meme that makes fun of COVID, you take that as a cue of my own attitudes, that I am okay with, that I don't take COVID seriously. And then if you don't take COVID seriously either, you're going to kind of build that solidarity, and you'll be free to express your views more freely. Is that in line with what you were saying?
Yeah, yes. Yeah. It was more related to linguistic intimacy, but the point is the same, I think.
I think it is, yeah.
You know, the intimacy.
Yeah, I come more from psychology, so I'm not too familiar with the linguistic side of things, but that sounds pretty similar here. Might be same basic theory, different names.
From different perspectives.
Mm-hmm. Thank you.
Is there another question from the audience? think, yes, again, I think there's a hand. Yes, Oksana Pavyuk.
I have a question. Did you trace some neologisms connected with humor situations, such as I was investigating the role of slangs in nominating COVID phenomenon, yeah, like COVIDiot, or quarantine plus martini, a quarantini party. Did you trace some other language means which I used to describe humorous situations? Thank you.
I'm not sure I understand the question here. So are you asking what kind of humor I looked at, or?
Yeah, what kind of humor and what kind of language means I used to describe these humor situations?
Gotcha. So we just looked at internet memes. We pulled these from different posts on Facebook and Reddit, wherever we could find them, Google searches. And all the memes were pretty straightforward. We didn't use any satire, nothing too complex to process. We wanted things to be understood at a very surface level. Part of that is because a lot of work on disparagement humor, when it comes to subversive satire humor, shows that stuff is easily misunderstood, even when it's meant to say one thing, people read as another. So we didn't look at that complex stuff quite yet. And let's see.
Any particular neologisms, new words, yeah?
No new words in there, I don't think. If memory serves, there was a meme making fun of calling it a conspiracy theory from Zoom. There was 2 or 3 memes making fun of the high survival rate, but no terms like COVIDiot or anything like that.
Okay, thank you.
Yep.
Yes, one question from my side as well. What I thought is interesting, is it possible to somehow disentangle the effects? Because humor also sometimes it helps us to cope, right? In terms of crisis, it helps us to cope with these difficult situations. And sometimes also, I mean, like some kind of sarcasm is there, I mean, which is not meant badly. And it helps me to like make something a bit funnier, but at the same time, it can also have the similar adverse effects. So do you think there is something of intention, like the intention of the joke, which drives the effect, or is it no matter what I intend to do with the joke, just the joke will do the same effect?
Thank you for that. So a lot of it's going to boil down to, so let me see. I definitely agree. There are positive uses here for this type of humor as well. It basically boils down to knowing your audience. If you're in a crowd of people that don't take COVID seriously, then these memes are, this type of humor is going to have negative effects. They're going to promote their unsafe behaviors. Whereas if you're just with other people that treat the COVID pandemic seriously, they view COVID as a threat, understand the severity of it, those memes are not going to change their attitudes. They're not going to change their behavior at all. If they are able to appreciate that kind of humor, regardless of that, they'll enjoy the humor without any of the negative effects. Does that make sense?
Yep.
Yeah.
Makes sense.
Yep.
And which role do you think humor plays in there? Something like some kind of, there could be a similar messaging, an impact on a joke, or just in a similar message. So do you think it's actually the humor that drives these effect of the more tolerance or less tolerance?
It's not necessarily the humor itself. A lot of work on disparagement humor has shown that the serious disparagement, like just non-humorous disparagement, shows the similar impact. The main reason to look at humor is that it's more innocuous. There's the just a joke excuse, where you can get away with saying more as a joke than as a serious tone. So that's the main takeaway there, is just you can express this anti-masking behavior, anti-masking sentiment, anti-vax, without repercussions, basically, if you say it as a joke.
Yeah. Okay. Yes. Well, thanks a lot, Andrew. If there are no other questions, I think we'll move on to the next presentation. So thanks a lot for presenting this interesting study. The next study is on of role of education, risk perception, and social trust in predicting intent to get the COVID-19 vaccine. And I think I see Amina here in the call, right?
Good morning, everyone, from Providence, Rhode Island, the US. I'm here with my colleagues. This is actually a project which is a collaboration between 4 universities. Our project used data collected by MIT in collaboration with Facebook. This is survey data from 23 countries. And what we wanted to look at is the role of education and perceptions of health risk and trust in health sources, particularly scientists and politicians, and the impact on people's willingness to get vaccinated in the future. And what we found was that trust in local and global health experts was a significant predictor of future intention to get vaccinated, as well as people's perception of community health risk was also positively related to getting vaccinated. And the other thing we found, which was interesting, is that there was a country level difference on education. So in some cases, participants who are educated from Egypt and India were more hesitant about getting vaccinated versus less educated participants from countries such as Brazil, France, US, and UK. So we thought those education had an interesting role, as well as gender as well. Men were more likely to be influenced by perceptions of community health risk to say that they would be more likely to get vaccinated because of the community health risk. And I'll ask my colleague Stephanie to share some of the implications of our study for health communication research.
Yeah, thanks, Amina. So I think based on some of our findings, some of the takeaways would suggest the importance of emphasizing community health risk and maybe thinking about the target audience for different messaging, and also incorporating local and global health workers and health campaigns to increase vaccine acceptance.
Thanks a lot for the presentation. Are there any questions from the audience? Otherwise, I just quickly start, or maybe, oh, there is a question from Andrew.
Yeah, so you mentioned the importance of emphasizing this community health risk in future campaigns. I saw your presentation, and it looks like it's been a few months since that data was collected. Have you done any further tracking to see if these, if communities where that type of messaging was the focus are showing higher vaccination rates than those where they did not use that community-oriented approach?
I can start. So no, we haven't, and partly because MIT is using the same survey questions. So this is a recommendation that we are making based on our data, not necessarily what the survey is doing. So the survey, they do update some of the questions, but many of them have remained the same since they started last year.
Gotcha. Yeah. Do you think those communities that have gotten those that community-oriented messaging, would they be showing the higher vaccination rates you're thinking, or just casual observation I'm asking for at this point? So
yeah, I mean, I think that is, we probably need to go back to the data and see now that, especially with the new variant, and I think that just the availability of vaccines as well in many other countries, if that might change, and also the community level risk. So it's possible that we might see a difference now, given the changes in just the last few months.
Yeah.
So, but I don't know, we haven't done that yet.
No, thank you.
Thanks a lot. Are there any more questions? Okay. Yes. So one question for me would be, I think, so this is Facebook data as far as I understood this. Do you think there are any kind of issues with this kind of data? I think it's a very novel way to collect data, but are there any kind of issues? And I think yesterday there was a new paper in Nature, I think actually published on bias or probably some representativity in Facebook samples, and that actually also, I think, predicted some kind of different vaccine uptake. So have you thought about this and any other ways of collecting data?
Yes, excellent question. And I would actually ask David or Garrett, we're also on the call. We, as a group, we have discussed this, the limitations of using Facebook data and I think survey data in general. So maybe if David or Garrett, you want to chime in.
Yeah, I can just briefly say I don't think it's so representative. Looking at the demographics and across the countries. So you have countries where far more males respond. That's definitely a cultural issue, and access to social media and internet. And then you're not having the age proportions. You have an overrepresentation of, I think, 30 to 39. In some countries, it's 20 to 29. That's a steep decline from 60. And in terms of education, I'm also skeptical, but that is generally true for all kind of studies where you rest on volunteers. It's never representative because the people on the low education and low income, they are very skeptical for taking part in research. So that is, I think, not a problem of Facebook per se, but they claim they have the census data, so a proportion of people, and they try to target them. So they see, okay, we need specifically to get more in this age group, then more of them will get get the study presented. But what is also obvious is, and I've also run other online studies, very few only finish. And because you do this often during other things when you're on social media, I think we have maybe only 5% that really completed all scales. I think this is yeah. I'm not sure I would go forward with this unless I have extremely short survey. Really just want to use trends, very short polls. But for everything more than that, I think you're getting more with better quality data than trying this huge quantity that Facebook has managed. So the trade-off is here extremely high quantity, but just for what we wanted to look at, the scales, we lost over half of the data.
Okay.
And then I don't think it's, I mean, it's very hard. There is no statistical proof of missing of randomness, as you may know. But it's, you just have to assume that it's missing this by randomness, why people are not completing them, maybe interrupted or so. But yeah, I mean, they had no incentives. That's a good thing. That's really also the positive thing. You just did it when you felt like, oh, it sounds interesting, or yeah. So there are also positives, but I'm a bit hesitant at the moment to say that this quantity makes up for good quality.
Okay. Well, thanks a lot for the answer. It was very insightful. I mean, I guess all kinds of samples have could have some problems. Matteo, did you have a question, or sorry, or
no?
No. Okay. Then maybe just quickly, just the last question, and maybe a brief answer, because we have to move on to the last group. You had one interesting, I think, finding on education, whereas in one country, some countries, high education would predict more willingness to get vaccinated, and others, high countries would predict the opposite. So it's a kind of interesting effect. Do you have any hypothesis why this is?
I can also just tune in. I think it's again related a bit to the demographics, I guess. So the countries where they are coming from. I would guess that, for example, in countries where mostly male could respond, that they are, I think it was India, for example, they are more skeptical. So yeah, I think there's an interaction. It's not only education. It's
okay.
Yeah, short answer.
Yeah, and I think also there's some research suggests how people use information differs a bit by education, and what kind of information they're seeking out, and kind of how they're like who they're trusting. And I think there is, like as Garrett said, I think there's a little bit of an interaction there happening in terms of education by some of the other factors in terms of trust and who you're seeking out information from and whatnot.
Okay. Well, yeah, thanks a lot for the presentation. I think we just have to move on to the last presentation. Sorry, I think it would be also interesting to discuss this further. I think we'll probably run 2-3 minutes over time, just as a background. So I think Matteo Lisi is here with a study on interpersonal distance modulation on individual and social behavior related to the COVID-19 pandemics.
Hi, thank you. Hope you are hearing me well.
Yes.
And yeah, just quickly resume my study. Was an investigation of the factors that could affect the regulation of interpersonal distance during the first pandemic outbreak. And we considered variables related to individual traits of perceived vulnerability and perceived risk, but also traits related to prosocial behavior and morality. Since we know that interpersonal distance can be affected both from avoidant and self-protective motives, but also affiliative and bonding motives. And we also consider the situational factors that relevant in this context, such as the wearing protective equipment or not, and the diagnosis of the other person. So we collected data online using visual analog scale task, which was previously validated by another group. And we observed that the most relevant factors affecting interpersonal distance during the first pandemic outbreak were wearing protective equipment and the diagnosis of the other person. We observed that not only the distance was reduced when the other person was wearing a mask, but also this happened when the participants were aware of the risk of infection. So this study is yielded results similar to other studies investigating the role of mask wearing in the regulation of interpersonal distance. It seemed that wearing a mask could induce perceived safety during the interaction, which in some contexts could be detrimental to the control of the contagion.
Okay, thanks a lot for the presentation. Yes, are there any questions from the audience? I think Marta has a question, yes?
I saw your presentation, and yeah, basically your results are in line with our results, what we found for physical distance. And I was wondering, I don't remember if you also found gender differences.
We found a trend for male participants overall to keep a shorter distance compared to female participants. And yeah, we consider that some studies on COVID found that overall male participants were adhering less to the barrier gestures, showed less compliance with barrier gestures, but this was just a trend in our study, not a strong effect.
Is there another question in the audience? Okay, then I think I have one question. Or in general, do you have any insight how people coped with this lack of physical contact in this lockdown times?
Yeah, not on our study, but yeah, other studies investigated the effects of contact deprivation during the lockdowns, and there is one study of Von More and colleagues that show that those people who lacked intimate contacts, such as hug, kissing, during the pandemic, were also the most anxious and showing depressive states. And overall, across people, intimate forms of contact are the most craved during the social isolation. So on our side, we investigate how virtual reality can in part recreate similar experiences of intimate contact, but we don't know whether this could somehow be effective during periods of social isolation, inducing positive affective states.
Yeah. Okay. And do you have any ideas for how technology can help with like supporting compliance of physical distancing? I think you had some insights there as well.
We know that we can, of course, recreate in virtual reality a lot of contexts and social situations, and maybe train people to comply more with these rules, but there is no study showing this yet.
Okay. Well, if there are no other questions from the audience, I would, thank you as well for the presentation, and in general, thank you all the panelists for presenting. Maybe a quick round of digital applause for everyone presented.